Hello, everyone. Again, I'm going to discuss a PESCI case, or you could convert it to a AMC Part 2 case, or even a GP exam case. This is what I'm going to discuss today, one of such case, which you could use for your PESCI or AMC Part 2 or GP clinical exam. I'm going to use my own language as well. That will help some of our Sri Lankan doctors too. අද මම කරන්න යන්නේ ඇත්තටම මේක PESCI වලටත් ගන්න පුළුවන්, AMC Part 2 වලටත් ගන්න පුළුවන්. ඒ වගේම GP exam එකේ කියන්නේ RACGP fellowship exam එකේ කේස් එකක් විදිහට සලකන්න පුළුවන් එකක්. ඔය තුනටම ගැලපෙන විදිහට අපි මේක සාකච්ඡා කරමු. එමනම් අපි පටන් ගමු. Case runs like this, okay? So there's a lady who's 39 years old and she's an Aboriginal woman who works in retail sector, and she has just moved to the area recently, and she has been seen by one of your colleagues last week. She has come to see him for some scripts, and your colleague has suggested for her to book in for an Aboriginal adult health check. Okay, so that's the case. And there's a limited summary provided, which include her past medical history. In her past medical history, it says she has diabetes, and she's on metformin XR 2 gram daily and sitagliptin 100 milligram daily. So this case is actually given as a short viva, or as a like a, how to say, as a PESCI viva exam. This can be used in AMC2 in a similar way that examiners can ask you a question without you needing to talk to the patient. Okay, they might guide you to talk to the patient too. Okay, to my Sinhala colleagues again. අවුරුදු 39ක විතර Aboriginal ගෑනු කෙනෙක් ගැන තමයි කියන්නේ. එයා රිටේල් සෙක්ටර් එකේ කියන්නේ සුපර් මාකට් එකේ වැඩ කරනවා. ළඟදී තමයි එයා මේ පළාතට ඇවිල්ලා තියෙන්නේ. පහුගිය සතියේ එයා ඔයාගේ වෙන ඔයාගේ ක්ලිනික් එකේ වෙන GP කෙනෙක් හම්බ වෙලා තිනවා. ඇවිල්ලා තියෙන්නේ ස්ක්‍රිප්ට්ස් ගන්න. ඒ කියන්නේ මෙඩිකේෂන් අරන් යන්න තමයි ඇවිල්ලා තියෙන්නේ. ඒ ආපු වෙලාවේ ඒ GP කියලා තියෙනවා ඕකේ ඔයා බුක් කරන්න Aboriginal health check එකකට කියලා. ඊට පස්සේ past medical history එකේ තියෙන මෙයාගේ diabetes mention කරලා තියෙනවා. ඊට පස්සේ එයා metformin XR gram 2කුයි sitagliptin milligram 100කුයි ගන්නවා කියලා තියෙනවා. ඊට පස්සේ දැන් මේක viva scenario එකක්. ඒ කියන්නේ examiner questions අහනවා. එතකොට PESCI case එකේදී PESCI examinersලා මේ විදිහට ඕගොල්ලෝගෙන් අහන්න පුළුවන්. හරිද? දැන් ප්‍රධාන මාතෘකාව Aboriginal health check. බලන්න මේක සමරයිස් කරගන්න බලන්න. Aboriginal health check එකට එන්නේ. ඊට පස්සේ මෙයාගේ past medical history එකේ diabetes තියෙනවා. diabetes වලට මෙයා medication දෙකක් ගන්නවා. වයස අවුරුදු 39 40ට ඔන්න මෙන්න retail sector එකේ වැඩ කරනවා. ඊට පස්සේ මොන වගේ ප්‍රශ්නද අහන්න පුළුවන්. මේක කෙලින්ම කියනවා මෙයා එන්නේ Aboriginal health check එකකට කියලා. Okay, so the first question your examiner would be asking is, why is it important to identify Aboriginal and Prostrate Islander patients in your practice? So that's the first question he's going to ask. Why it's important to identify their Aboriginality or their sort of heritage or their cultural heritage. Why it is important for you to identify them as a GP in your practice. So what would be your answer? First of all, you have to know that we need to respect our patients' cultural heritage, whether they're Aboriginal or whether they general Australians, or whether they have moved from, say, Middle Eastern countries, or whether they have come from Asia, whether they have a different religious background, different cultural practices, different way of living. All these we have to respect to. Yeah. So සිංහල අයට කිව්වොත් ඇත්තටම දැන් මේකේ ප්‍රශ්නේ අහන්නේ මොකද මේගොල්ලෝ Aboriginal හරි Prostrate Island කියලා අඳුරගන්න එකේ වැදගත්කම. ඒ කියන්නේ අපි ඒගොල්ලෝ අඳුරගන්න ඕගොල්ලෝ මේ අයද කියලා අහනවා. එහෙම ප්‍රශ්නකුත් අහනවානේ. හැම ක්ලිනික් එකේ මෙහෙම ප්‍රශ්නයක් තියෙනවා. ඇත්තටම අපි GP ලා විදිහට අපි ඒගොල්ලෝ රෙජිස්ටර් කරගද්දී සහ බලද්දී මේ අපේ software එකක් තියෙනවනේ. ඒකෙත් ඇත්තටම මේ අය අඳුරගන්න වෙනම question එකක් තියෙනවා. Are you Aboriginal or Prostrate Islander? or ඒ question එක අහනවා. එහෙම නැත්නම් different language speaking එක්කෙනෙක්ද මොකද්ද ඕගොල්ලන්ගේ මේ nationality කියන එක අහලා අහපු ප්‍රශ්නයක් තියෙනවා. ඉතින් මේකේ අහන්නේ ඇයි එහෙම අඳුරගන්න එකේ වැදගත්කම කියලා. Let's try to answer that question, why it is important to identify Aboriginal and Prostrate Island patients in our practice. So first thing, as I mentioned before, we need to provide culturally safe and culturally acceptable medical care. Okay. What do we mean by culturally safe and culturally acceptable care? Because as I just mentioned in my language, that in Sinhalese I mentioned that I'm going to tell you that in English now. Why it is important? First thing is we need to make sure that we provide culturally safe medical care. What do you understand by cultural safeness? One thing is different cultures may have different things in common, and they may not be taught in our medical school, for instance, or they may not be what we know from our background, our cultural background, or ours, like as international medical graduates, we might not have exposed to these things. Obviously, for the Aboriginal culture we haven't, so we have to learn this. So one thing is, for us to provide Aboriginal people with culturally safe medical care, we need to know some important things about their cultural practices. One is this, I can give you an example. They have what we call, they expect us, or they would prefer, like a male Aboriginal person would prefer to talk male related issues with a male doctor. This is called men's business. Yeah. And likewise, the female Aboriginal people would like to talk to their sort of private female issues with female doctors. So that's, if you know that, you will acknowledge that, and you will tell your patient. For instance, if you get an Aboriginal patient in front of you, you would say, like, if it's related to their periods or their pregnancy or their say genital discharge, or something related to their sort of sexuality or their like male femaleness, then you would offer, okay, you would offer that, okay, you would tell something like this: I know that this is women's business. You want me to sort of organize a lady doctor to discuss this with you, or is it okay if I discuss? Something like that. So you acknowledge that you respect their cultural heritage. And then there's another thing about this, knowing that their Aboriginality, why it is important is we can offer, like, they may not be talking in English, all of them. Then if it is the case, then you can offer an interpreter, or you can offer a culturally acceptable person, or Aboriginal health worker, or Aboriginal some social worker related to them. Yeah, so you can offer that one. So those are two things. And then one more thing would be like, some of the issues are very common in Aboriginal people, unfortunately. One would be the chronic diseases or chronic diseases like diabetes, blood pressure, obesity, those things. Then if you recognize them as Aboriginal people, you will take extra care to look for those conditions, right? Likewise, if you think about any other cultural heritage, for instance, Middle East or Asian, then again, like countries like Sri Lanka, India, again, this metabolic syndrome is on the rise. So therefore, you would be looking for blood sugar and, cholesterol and blood pressure issues. So therefore, it's very important to know their cultural heritage. That's why it's important to recognize them as Aboriginal people. One more thing about recognizing is Medicare or the Australian government provides some incentives to make sure their health being looked after. One such thing would be Medicare incentives provided for the patients as well as for the clinic, your clinic. So if you recognize the patients in your clinic as Aboriginal patients, then your clinic would be registered as Aboriginal friendly clinic or clinic with inputs from them. And then there are some Medicare items for that. I would discuss that in next few questions, right? Okay. To summarize again, why it is important to recognize them as Aboriginals in your clinic. One is to provide culturally acceptable care or safe care. For example, men's business and women's business. If I try to clarify to you what do we mean by men's business, is anything related to male issues like erection issues or sexual issues or any pain in testicle or anything like that. They would prefer to discuss that with a male person or a male doctor. Then women's business is anything related to women like periods, genital discharge or pregnancy related or sexuality related, then they would like to discuss it with a female doctor. If you are aware about their cultural issues, then you would be offering support in that way, like the way I discuss that example. Okay. In singular, Aboriginal අය ඒ විදිහට අඳුරගන්න එකේ වැදගත්කම තමයි එකක් තමයි ඒ අයගේ තියෙනවා men's business and women's business කියලා එකක්. ඒ කියන්නේ men's business කියන්නේ පිරිමින්ට අදාළ කාරණා. ඒ කියන්නේ ලිංගිකත්වය, ඊළඟට sexual, ඒ කියන්නේ ලිංගිකත්වයට සම්බන්ධ දේවල්, ඒ වගේම මොනවා හරි discharge එකක් තියෙනවා නම් හරි, එහෙම නැත්නම් කියන්නකෝ වෘෂණ කෝෂවල කැක්කුමක් හරි, ඔය වගේ මොනවා හරි තියෙනවා නම් ඒ පිරිමි කමට අදාළ දේවල් ඒගොල්ලෝ කැමති ඒවා පිරිමි ડોක්ටර් කෙනෙක් එක්ක කතා කරන්න. ඒකින්ද men's business කියලා එහෙම එකක් තියෙනවා ඒගොල්ලෝ. ඒ වගේම තමයි women's business කියන්නේ ඒගොල්ලන්ට ඔය periods හරි, එහෙම නැත්නම් කියන්නේ ලිංගික ශ්‍රාවයක් පිටවීමක් හරි, මොනවා හරි abnormal ශ්‍රාවයක් හරි, ඊළඟට ඒ වගේ දේවල් ඒගොල්ලෝ කතා කරන්න කැමති ගෑනු අය ගෑනු ડોක්ටර් කෙනෙක් එක්ක. ඒකින්ද ඒකට කියනවා women's business කියලා. ඔන්න ඔය දෙක තමයි men's business and women's business කියන්නේ. ඒක ගැන අපිට අවබෝධයක් තියෙනවා නම් අපි ඒ ගැන ලෙඩුත් එක්ක කතා කරලා ඒක පරිස්සමෙන් ගනුදෙනු කරනවානේ. ඒකින්ද ඒක වැදගත්. අනිත් එක ඉන්ටර්ප්‍රිටර් කෙනෙක්, ඒ කියන්නේ භාෂා පරිවර්තකෙක් දෙන්න හරි, එහෙම නැත්නම් Aboriginal health worker කෙනෙක් දෙන්න හරි අපි පෙළඹෙනවා ඒගොල්ලෝ Aboriginal කියලා දැනගත්තා. ඊළඟට ගොඩක් ලෙඩ රෝග ඒගොල්ලන්ගේ අතර තියෙනවා. එකක් තමයි ඔය මෙටබොලික් සින්ඩ්‍රෝම්. ඒ කියන්නේ දියවැඩියාව, අධිරුධිර පීඩනය, කොලෙස්ටරෝල්, ස්ථූලතාවය, ඒ වගේ ඒවා ඒගොල්ලන්ගේ වැඩි. ඒකින්ද ඒගොල්ලෝ Aboriginal කියලා අඳුරගන්න එක වැදගත්. තවත් මෙතෙන්ටම කියන්න ඕනේ ඒගොල්ලන්ගේ සිගරට් දුම්පානය සහ මද්‍යසාර, ඊළඟට ඔය මේ කංස වගේ ඒවා ගන්න ඒවත් ඒගොල්ලන්ගේ වැඩි. ඒකින්ද ඒ කියන්නේ alcohol, smoking, drugs related issues ඒගොල්ලන්ගේ වැඩි. ඒකින්ද ඒක අඳුරගන්න එක වැදගත්. ඊළඟට Aboriginal අය අපේ ක්ලිනික් එකේ රෙජිස්ටර් කරගන්න එකෙන් අපිට ඉන්සෙන්ටිව් එකක් හම්බ වෙනවා ක්ලිනික් එකට. ඒ කියන්නේ මුදලක් හම්බ වෙනවා මෙඩිකේර් වලින්. ඒ වගේම Medicare එකෙන් ඒගොල්ලන්ටත් උදව් කරනවා මම ඉදිරියේදී ගැන කියන්න. ඒකින්දත් ඒක වැදගත්. So that in that way we covered the first question your examiner would ask. The second question your examiner is going to ask is, what would you do to check her diabetes? What would you do to check her diabetes? Okay, because you know that in the history they say she got diabetes and she's on metformin XR and sitagliptin. So what would you do? Your examiner asked. You are expected to give answers like this, right? One thing is, like, if a person got diabetes and they got high risk, they are in a high risk group. Aboriginal group is high risk for diabetes and metabolic syndrome, as I said before. So then you have to make sure that it's well under control, and then you have to make sure that she's handling her diabetes well. To check this, you would be asking few questions from her, like you could ask whether she's checking her blood sugar and how are the sugars when she checked, and is she's taking these two medications. Then you can ask things about whether these are the suitable medication regime for her, like whether she's having any side effects or whether she's taking it correctly, or whether about the compliance, right? And then whether there's any issues or barriers to take the medication. For instance, we're not always thinking about, but it's better for us to check that to see whether they can afford the medication, or whether they have issues of whether they have any financial issues of providing, or at least to pay for the medications, right? So that's another thing you would be checking with diabetes and needs. Then, because as I said, I mentioned before, they are in a high risk group for this metabolic syndrome. This can be explored further in this question, or you can tell the examiner, like, we're going to explore this, to see whether she got risk factors which can be modified, right, for diabetes. What are those modifiable risk factors for diabetes? We use this word SNAP, S-N-A-P, SNAP, which is to smoking, nutrition, alcohol, and physical activity. So you would check for those. You ask whether she's smoking and how many cigarettes she's smoking a day. Your examiner can take you into town here, whether she's taking a lot of cigarettes a day. Then you are expected to ask whether you can do a brief intervention to stop smoking, or you advise her to come back for a smoke cessation session, and whether she's related to those habits like smoking and alcohol. You ask some questions to see whether she's kind of dependent on them, to see whether she's taking the first thing in the morning, whether she's lighting a cigarette early morning, or whether she's smoking, like chain smoking, whether she's smoking one after the other, and how many she is doing a day, and then how many years, how many pack years, and things like that. So your examiner could explore a bit more. Yeah, but in general, you're checking for smoking, nutrition, alcohol, and physical activity here with regards to the diabetes control, which in short form, in GP arena or in AMC exam setting, we talk about the SNAP: smoking, nutrition, alcohol, and physical activity. Again, nutrition, what sort of diet, whether it's a balanced diet, or is it rich in carb, or is it takeaway food, or whether she's taking enough fiber, things like that. Then alcohol, again, how many standard drinks a day, how many per week, and how long. And then again, you can ask here what we call audit questions, AUDIT questions. You can search this in Google. So likewise, your examiner can explore a bit more. Yeah. So this is where we discuss about the modifiable risk factors for diabetes. Then you expected to check her, weight, height, and waist circumference, or body mass index, BMI, and waist circumference, and check for her cholesterol profile, lipid profile. These things we in GP arena, we talk about diabetic cycle of care. So this is kind of, these things I mentioned actually are in that diabetic cycle of care. So you do check her HbA1c at least once a year, and then you check her body mass index, weight, height, and waist circumference, and then you check her lipid profile and ask these questions about SNAP questions. Yeah. That is what you do for diabetes. What else? I just started talking about the blood tests. So what sort of blood test you would be doing? You would be checking for like few things you will be doing. One thing, you look for the complications of diabetes, or checking for like eye complications or retinal complications, then cardiovascular complications, then renal complications, and feet. Yeah. So you would be checking for these, what we call end organ damage. So that means annual check for optometry check or ophthalmology check. Then you check her heart, like listen to her heart and check blood pressure, pulse, and take an ECG. Checking for kidneys, what we do usually do is we do a blood test, UEC and urine albumin, or urine ACR. And then annually, at least annually, you check her feet. Either you refer her to a podiatrist and they do it, or you are a practice nurse, or you yourself can do it. What we do is like checking for her skin, peripheral pulses, monofilament testing. Here again, your examiner could take you for further. Like he could ask questions about how do you check diabetic feet, diabetic foot. Tell me what do you do for diabetic foot exam? Something like that can be asked, especially in the PESCI scenario. They could ask that question. AMC one would be like 8 minutes one. It would be a quick one. Yeah. Then let's talk about the third question your examiner is going to ask. Third one would be, she has just moved interstate as a newly single parent here. The cost of her diabetic medication is overwhelming. What could you do to assist? That's the question your examiner is going to ask. Your patient has moved interstate as a new patient here and as a single parent. She's helping her children with as a single mother, and because of that, cost for diabetic medication is high. She can't afford. And in this sort of scenario, what would you do? That's your examiner's question. Remember, she's an Aboriginal patient and she's a single parent and she's almost 40 and she got diabetes. So this question is specifically asked about whether you aware the facilities you can provide for your patients, depending on their cultural background, especially for Aboriginal patients. There are specific incentives coming from the Medicare. There is a thing called Closing the Gap Initiative, or CTG. Your patient might ask you, like one of your patients might ask you to say, okay, she comes here for a script and she could ask for you to write, doctor, please write CTG, that is Closing the Gap. So that means if she is registered under the Closing the Gap scheme in your clinic, then what will happen is she get all her medication for free, right? Because it's covered by the Medicare. So she then doesn't have to pay out of pocket. So if you know that there's this Closing the Gaps initiative, and then if you register her for the Closing the Gap program in your clinic, there's a set of forms, then she will get the medication for free. So that is the question. That is why your examiner is asking this question, to make sure that you're aware about the closing the gap. Yeah. One more way of helping her, if it's expensive, would be, like you got sitagliptin and metformin. She's taking two medications, so you can give a combination medication, right? You can, I can't remember the brand name, but you can combine those medication into one pill and give it to your patient, prescribe to her. That would be cheaper to her. Your pharmacist will usually guide here. And then one more thing is like to help her financial certain difficulties and to make sure that her diabetes is under control. What you can do is like you can do the Aboriginal and Prostrate Islander adult health check, which is what she's come for here. That is the Medicare item number 715. So you could give that Medicare item number, so health check. And also you can do what we call a GP management plan or chronic disease management plan and a team care arrangement. These are Medicare item numbers 721 and 723. All these you can search in Google, then you will find out. So the team care arrangement is I'll describe it a little bit to you. GP management plan is a plan created by the GP for the patient, and it is involved chronic diseases like here diabetes and cholesterol and things like that. And they should be more than 6 months. She has been suffering that condition for more than 6 months at least, like a chronic condition. And there should be a team involved. Team include yourself as GP, your practice nurse, and then specialist if they are, like a endocrinologist or any other specialist, and then allied health professional like podiatrist, diabetic educator, dietitian, and physiotherapist, and optometrist even. So those different allied health professionals can be taken into the plan, and that is what it's called team care arrangement, right? The item number 723. Through that, if you organize those plans with your Aboriginal patient or any other patient for these 721 and 723, then you can provide them with Medicare funded visits to the podiatrist, diabetic educator, so subsidize access to this diabetic educator and podiatrist, yeah, or even dietitian if she's needing. So those can be done through these plans. Then the other next question your examiner is going to ask you from is this question. You realize that the practice does not see any Aboriginal patients, many Aboriginal patients. How could you ensure your practice is culturally safe and welcoming to Aboriginal and Torres Strait Islander patients? This is the question. Your examiner asks, you realize that the practice does not see many Aboriginal patients. How could you ensure your practice is culturally safe and welcoming to the Aboriginal and Torres Strait Islander patients? So how do you answer? Then you would say, to create a culturally safe practice in your clinic, all of your staff should be undertaking cultural training, Aboriginal culture training, ideally offered by an Aboriginal person, local, or Aboriginal health worker or Aboriginal health unit. And that's one thing. And then the other ones would be you can demonstrate flags, their artworks, different posters and things on the walls of the clinic. Usually you would see in many of the clinics here, these things are displayed, right? So that would be the answer for that question. Then the last question your examiner would ask is like, what resources or guidelines might help you to deliver the most appropriate care for your patient? So there are different resources like there would be many, like you could check for, like you could Google this, like Aboriginal and Torres Strait Islander health, then you find health resources, then you will find a few resources. Two of the things I can mention here would be National Guide to Preventative Health Assessment for Aboriginal and Torres Strait Islander people. That's one thing. That's a national resource. And then there would be many local guidelines, like, Northern Territory guidelines or Kimberley Aboriginal Medical Health Service guidelines, things like that would also be there. So those are the answers, or the questions and answers for this scenario. Now I will speak in Sinhalese for some of my patients, some of my viewers. දැන් මෙයාට බෙහෙත් ගන්න සල්ලි නෑ කියලා කියනවා, මේ මොකද එයා සිංගල් පේරන්ට්ස්, ඒ වගේම එයා ළඟදි මේ පැත්තට ආවේ කියලා ප්‍රශ්නයක් අහනවා ඔයාලගෙන් එක්සැමින්. එතකොට ඒකට දෙන්න තියෙන උත්තරේ තමයි එකක් closing the gap initiative එක ගැන කතා කරනවා. closing the gap කියලා එකක් තියෙනවා. closing the gap කියන එකෙන් කරන්නේ ඇත්තටම Aboriginal අයට Medicare එකෙන් health care card එකක් දෙනවා. ඒ කියන්නේ ඒගොල්ලන්ගේ බෙහෙත් සම්පූර්ණයෙන් free ගන්න පුළුවන්. ඉතින් එතකොට මේ closing the gap initiative කියන එක ඕගොල්ලන්ගේ ක්ලිනික් එකේ රෙජිස්ටර් කරන්න ඕනේ. patient closing the gap registered patient කෙනෙක් බවට පත් කරගන්න ඕනේ. ඒකට ෆෝම් සෙට් එකක් තියෙනවා. ඒක පුළුවන්. ඊට පස්සේ මම එහෙම කරනවා. ඊළඟට එහෙම Aboriginal closing the gap registered clinic වලට ඊට පස්සේ Medicare එකෙන් සල්ලි දෙනවා. කියන්නේ ඕගොල්ලන්ගේ practice manager ට තව මුදල් හම්බ වෙනවා. ඒක කරන්න පුළුවන්. අනිත් එක තමයි Aboriginal and Torres Strait Islander adult health check කියන එක කරන්න පුළුවන්. ඒක Medicare item 715 715. ඊළඟට මේගොල්ලන්ට දෙන්න පුළුවන් GP management plan එකයි team care arrangement කියන එකයි. ඒ දෙකෙනුත් අර podiatry, physiotherapy, diabetic educator ඒ වගේ අය බලනවා freely. ඒ කියන්නේ Medicare funded ක්‍රමයකින් දෙන්න පුළුවන්. තව එක question එකක් මට මිස් වුණා ඇත්තටම අනිත් අයගේ, what other screening would be important for Sharon at this point කියලා එකක් තියෙනවා. මේ ලෙඩාට මොන වගේ other screening ඒවද කරන්න ඕනේ කියලා. එතකොට මේකට කියන්න වෙනවා මේ එයාගේ past history එක document කරලා immunization status, ඒ කියන්නේ ඒගොල්ලන්ට immunize කරලා දෙයා කියලා. ඊළඟට family social history, ඒ කියන්නේ history එකේ නැති ටික, allergies, physical examination ඒක කරලා නැත්නම් ඒ ටික ගිය සතිය කරලා නැත්නම්, ඒ වගේම pap smear, mammogram එකට තාම මෙයාට mammogram එකට වයස නැහැ, අවුරුදු 40නේ. pap smear කියන එකයි අනිත් එක මෙයා single mother කියපින්ද ඇත්තටම pap smear එක්කම STI screening එකකුත් කරනවා මේ සාමාන්‍ය single mother සහ තාම තරුණෙක් කෙනා. ඒ ටික අහන්න පුළුවන්. ඊළඟට තව ප්‍රශ්නයක් මේකේ examine අහන ඕගොල්ලන්ගෙන්, ඕගොල්ලන්ගේ ක්ලිනික් එක Aboriginal අය වැඩි දකින්න ක්ලිනික් එකක් නෙවෙයි, මේකට මොකද්ද වැඩි කරන්න ඕගොල්ලෝ කරන්න පුළුවන් ඒගොල්ලන්ට එන්න එන එක වැඩි කරන්න කියලා. එතකොට අපි කියන්නේ අපේ ස්ටාෆ් එක කල්චරල් ට්‍රේනින් එකක් ගන්නවා. ඊට අමතරව කොඩි, පෝස්ටර්ස්, ඒ අයගේ පින්තූර ඒ වගේ ඒවා එහෙම දාලා තියෙනවා. ඒගොල්ලෝ වෙල්කම් කරන්නේ. එහෙමනම් අපි අදට නතර කරමු කියලා මට හිතෙනවා. අපි යම් දෙයක් කතා කරානේ. තියෙන ගැටලු මේක යටින් දාන්නකො.